Welcome to the LifeBeat podcast, a One Joshua Group production, providing access to information and experts to improve quality of life and health outcomes.
Thank you for joining us. I'm Kermit Payne, your host for LifeBeat, a podcast series. We're always excited to have guests like our today's guest to share with us very important information around health disparities, health equity, health justice, and particularly some of those things that define the social determinants of health. Joining us today is Dr. Monica Esquivel. Dr. Esquivel is at the University of Hawaii, Manoa. She is in the College of Tropical Agriculture and Human Resilience. Thank you for joining us, Dr. Esquivel.
Yeah, thank you for having me, Mr. Payne.
So we're going to start talking about food security. And we're going to go across the life cycle to talk about this. One of your publications looked at a program to address pediatric food security and health disparities. Can you tell us about that?
Sure, I'd be happy to. So our program is actually called the Keiki, in Hawaiian, it's Child Produce Prescription Project. I've been able to partner with a federally qualified health center, the Waianae Coast Comprehensive Health Center, who's really been a leader in this movement of connecting health center patients with all of the resources they need, including food, and improving healthy access to food. And so through this program, pediatric healthcare providers can identify children who they're seeing in their clinic who may not have access to enough food all times of the month, and provide them with vouchers to go to the community farmers market to get fresh fruits and vegetables that have been grown in the community.
So thank you for doing that, and thank you for your work. Sometimes I don't know that in our life that we stop to think about food and children. And I'm going to ask a question. I probably know the answer to that, but I'd like the expert to respond to this. Is there a food security problem for the children's population?
So absolutely, we know that in kind of an adult population, about 1 in 6 households, they don't have enough resources to get the food they need. And when you look at households with children, the number actually doubles. So there are children where, coming from these households, and they're relying on things like food available at schools and such to kind of meet the gaps. But absolutely, households that have children have experience higher rates of food insecurity than households with just adults.
So are there linkages between the food insecurity and long-term quality of life and health concerns?
So absolutely. So we know that children who come from households that have food insecurity long term, most immediately, the quality of their diet is not as high as a child from a household that has all the resources they need. So that means there might not be getting all the fresh food, maybe other kind of processed foods, and those health outcomes, those eating habits are established early in childhood. Those early childhood eating habits impact adolescence and health outcomes, and just begin the trajectory into chronic disease and poor diet habits later in life. So the impetus of starting with this pediatric population actually I was a registered dietitian. I actually worked in that clinic with those pediatricians, and they'd refer the children who had, high body mass index or childhood obesity. Their families would come to see me, and, their hands felt tied. Like, I'm doing the best I can. I'm keeping the lights on. I'm keeping the rent paid. Fresh fruits and vegetables is not falling in the family budget. And so the pediatricians actually really wanted this program. It felt like a tool that they could provide their families. So outside of just saying, you need to eat healthy food, they could give them a tool. We do that because we know if we can get these young children, get their palates used to eating these foods early, later in life, they'll demand it, right?
Mhm.
But
Yeah, it's interesting. You go to fast food restaurants. Of course, I don't go to fast food restaurants. I'm just kidding. But you can get a 4 for $4 or 3 for $3, and that's the cost of an apple. So if you have to decide, and that always amazes me that an apple is $3, but if you can spend that amount of money and get something that looks like a meal, it's really difficult to make a decision to purchase fresh vegetables versus prepared food. So the concept of a fresh food market gives people an opportunity as an alternative, makes it critically important. Do you think that diet, that eating, that access to food has psychological as well as psychosocial implications in this pediatric population?
well, there's so much of it, in these programs. In some of the adult versions of the programs for adults, we see that most of those patients we're serving on the adult side have mental health conditions, and these are
Mm,
the parents essentially of the children, in this pediatric population. And so there is a strong connection between stress, anxiety, and food insecurity. So I imagine, as I'm a mother of two, how the stress you feel in trying to get dinner on the table,
mhm,
and the stress I would feel if I didn't have the resources to even
mhm,
get the food. So that's stress, and how that stress, even in my own household, when I'm stressed, the feeling that my kids get from me, right? That I can't be nurturing, I can't think about helping with homework, all these things, these other things that children need when you have stressed parents or children are growing up in these stressed environments. It definitely, has those consequences. The other thing that we think about, especially in the community where I work, which is predominantly Native Hawaiian, is that in Native Hawaiian culture, there's a really strong cultural connection between land, the things that come from land, and a person's health. And when you give a person the opportunity to get food that's grown in the land, that they're being nourished from this land, you're
mhm,
actually like reconnecting them to their culture, to that land, and there's an added health impact, an added impact. We, in that pediatric program, families actually had two options for getting their vouchers redeemed. They could go to the community farmers market on Saturday or Tuesday. And so, to me, as a mother of young children, that means I'm getting my kids in the car
mhm,
down to the farmers market to get my fruits and vegetables. Or they had a free online farmers market that would deliver the produce to their house. And so, for me, I'm going the delivery route. I don't have to get these kids in the car and my schedule. And the families we've served in our program, they almost 9 times out of 10 pick to go to the farmer's market. And I hypothesize, and we hear in our qualitative interviews from these families, is that they feel a sense of purpose to get out of the house, to be in their community. The farmers market vendors who are selling the food that they've grown welcome them. They're excited to have them. There's not like, it's not a program where they feel there's some stigma attached to
mhm,
it or any of that,
mhm,
but they feel connected in their community. Getting
mhm,
to be a part of the program, I think, is and that I go back to those psychological, the stress,
mhm,
all of that. I feel
mhm,
connected in my community. I have resources, and I think that's like a maybe not measured impact of the
mhm.
program that we can explore more.
So that's an interesting, different take on culture. And you mentioned culture, and it's critically important. You also talked about BMI, and we looked at issues around culture. In those cultures, where BMI is greater than the norm is. Are the diets contributing to that, or is it the lack of opting to go to the farmer's market versus ordering online? So we went from diet to physical activity. Tell me about what does the data say? What do you say about those opportunities?
Right. So we see all those statistics about certain groups of people, ethnic groups of people, and their body mass index or obesity is higher. And I see obesity as an outcome of environmental and systematic structures that have been in place at this point for generations. So we're not seeing, like,
Mm-hmm.
this is not something that, like, they just tore down the playground the other day and there's no sidewalks for my child. This is generations of
Mm-hmm.
built environments that make the choice for parents. And then we say parents are the barrier to physical activity, because what do parents, our job is to keep our children safe, right? So if we don't feel it's safe to go outside in our neighborhood, we're not the barrier. That our neighborhood is not safe for our child
Mm-hmm.
to be outside, that's the barrier. So I see the cause of, this connection between these ethnic groups and having high BMI is nothing to do with their culture specifically or their ethnicity. Maybe a small part of it is genetics, a very small part. But I think the majority of the root cause is these systems where it's hard to get healthy food, that parents are choosing between kind of multiple unhealthy options. There's
Mm-hmm.
that healthy option is really not an option for them. It's not available in their community. It's not accessible or affordable on their budget. And then the spaces for their children to
Mm-hmm.
move and be free are just not really available either.
I'm trying not to get stuck on the pediatric population, but I think it's so important, and these behaviors are learned. So maybe if we spend a little more time on talking about children, that when we become now adult as 14 or 15, we used to be older, but the children's experiences are very different than they were in the past. So how do we create a healthier eating environment for children? How do as a parent, what do you offer as a parent to have a healthier eating experience?
Well, there's things that parents can do, like, regardless, I think, of what, but, budgets they have. But I think I go back to one of these things is that a healthy eating experience that most families can afford, that doesn't cost, is to have a pleasant eating experience with your
Mm,
child, to
mm,
sit down if you can and eat together with a screen off, with a device off. And I think that is one thing that across the board, if families could do that together with their young children and start to make that, that, I think, really positive things happen. And that's, their families will eat. And so if you can eat
mm,
together without devices and have that family meal time, I think that's one thing that families can do. Um, and I think another thing that we can do as, as parents, if you're sending your children to like a early childcare or preschool setting, thinking about all these places where kids are cared for, is
mm,
trying to, you know, think of ways that we can support healthy eating in those capacities. Um, a lot of it could be improved with policy change, and support for these childcare centers. Um, Childcare centers can serve like up to 80% of a child's like calories that they eat in a day. So if we can help to improve what's offered in those centers, I think that's another thing. Even something as simple as just making sure kids have water all day and having water available for kids to drink versus juice or something is something
mm.
kind of simple.
So that was my next question about policy implications in reducing obesity. And I really just didn't want to pigeonhole that just for a healthier lifestyle. Now, I have a registered dietitian question that's also a parent question. So here in the studio, we were talking about this earlier. Um, and so there was a discussion about children who only want to eat chicken nuggets and French fries and ketchup. So
Yes.
how do you introduce children, and let's say they're 5 and 7, they really are 5 and 7. So how do you introduce children to healthier foods at 5 and 7? I think it's a little more, and we were talking about that. So how do you introduce them to a different kind of eating?
Oh my God. I mean, I am a dietitian. I have a doctorate in nutrition, and my
Uh,
2-year-old is, you know, so so part of it, there's definitely a part of it is like food cannot be a battle. We don't like
mhm,
to have battles at the food dinner table, no battles. And I think that's kind of the first thing you start is that, okay, and then the other thing I really believe, and this is painful to watch you do this, is that I put those darn carrots and peas on that plate every day. And I, most of the time, end up eating them. I'd say 9 times out of 10, I'm eating those peas and carrots at the end of dinner because I don't want to throw them away. But on that 10th time out of 10, over time, those peas and carrots make their way onto that spoon into the mouth. But it takes so much like so many times over and over and over again that the kid is 5 and now they're 8 or they're 9 and now they're eating. I mean, it takes a long time, but it's making sure that those things that are available, it's on their plate. You can introduce them with those other foods that they like and they're familiar with. I'm really not into like hiding it. There's some
mhm,
philosophies, oh, just hide the vegetables. Like, I want my child to know that what they're eating. We talk about why it's important, and then I role model it. Right. So I'm not going to put a food on their plate that I'm not going to eat. And I would like them to see me eat it as
mhm,
well. Um, and having just positive discussions, talking about the foods in a positive way. And I think those are some things. It's definitely hard. It takes a lot of persistence, and some days we don't have that. I know as a mom, some days they've just broken me, but it's trying to just be consistent as the role model, and keeping it positive.
mhm.
Families. August is Wellness Month, a perfect time to reset, refocus, and recommit to our health together. We all want our children to grow up strong, confident, and full of energy, and it starts with the small choices we make every day. Healthy habits at home are the foundation for a lifetime of wellness. Let's try this. Add some colorful veggies to your child's plate today. Go for a family walk after dinner. Dance in the living room. Drink more water. These small steps make a big difference. When families move together, cook together, and support each other, it's not just good for the body, it builds strong bonds and lasting memories. Let's raise a generation that knows that food is fuel, movement is fun, and wellness is worth it.
So the dietitian perspective to a parent who has to deal with the stigma of an obese child. What's your thought? What's your message to families who are in that situation?
That is something, it's just terrible. I hate that we even have to have that discussion, but emphasizing to your child, you know, your body is a magical body. All bodies come in all different sizes, shapes, colors, and that it's doing magical things no matter what anybody tells you,
Mhm.
your body, and then talk about it in a positive way, the things that your body does, no matter what you're breathing, you're thinking, you're moving, you're engaged. Yeah, that part is hard. And, I'm not like in the psychology realm, but that's
Mhm.
kind of the body, loving your body is the most important thing. And just kind of emphasizing that point is that all bodies are all different shapes and sizes, and not one makes you better or worse than another person.
So when you're having the nutrition discussion, how do you pair that, or do you pair that discussion with physical activity, or are they separate? You address those separately, or how is that best having that discussion with children and adults as well? So how do you pair that discussion?
It's so interesting because I am married to a person who is professional in the exercise world. And so he and I have this very mutual respect as like a professional. This is your lane. This is my lane, right? And so I try not to go into their lane, but it's if you're there and a person's open to it, you talk about, and I don't like to call it exercise, is like,
Mm,
how do you like to move your body? Thinking about movement and how
mhm,
can you have more movement, and just thinking about ways like that. And so that's kind of how I would approach it.
mhm,
He might have some other very professional things, but to me, it's like, what are some ways that you can make moving fun in your house? Like put on some music and dance at home, or, even like doing little games where you have to try to match each other's bodies.
mhm,
There's different tools, but um, it happens all in this, it's all that same kind of idea that these are all the habits you want to see a child develop the liking for
mhm,
early. And then also goes back to role modeling
mhm,
movement, not using movement or even food as a reward or a punishment. Like,
mhm.
this is just something we get to do. I'm not going to withhold it if you don't do your homework. I'm not going to give it to you because you did your homework. That kind of thing. Yeah, those things.
I am encouraged and excited that when we begin to go back to the beginning of this conversation about food security, that we have an opportunity in a psychosocial dynamic. Eating um, is as psychological as it is nutritional, that we have opportunities, particularly with children, to engage with music therapy, to engage with dance therapy, something that children like, as a matter of reward for being, I guess you can't tell a 5-year-old about being compliant or adherent, but just sticking with the program and trying to get through that. So this is a fun discussion. It is a discussion that many parents have, and probably children have the same discussion in their own little minds. Um, because most children do want to please the person who's giving them the reward of the food. I think children recognize the food as a reward, and the taking away of that is the opposite of award. And Dr. Esquivel, I go back and I talk to my friends growing up when I was told you have to eat everything on your plate, everything.
Mhm.
So what happens now with parents who tell children that they have to eat everything on their plate? What's your direction for that?
So I have like, the two thought bubbles come out. The one is my mom telling me, like, look, I raised you and this is what you did and you turned out fine. And
Right.
then the other thought bubble is like, okay, well, what we know, like scientifically, like you have to clean your plate. And these are these like kind of traumatic, like food interactions we're trying to limit, is like the crying,
Hmm.
screaming child at the table who cannot leave until they eat that last pea on their plate. They're full, they don't want to eat now, they don't know even know why they're sad. They're just um what we're actually teaching kids when we make them finish their plate is we're not really teaching them to honor whatever cues in their body.
Hmm.
You got to go back like 5 layers. Did we really have we been doing that from the beginning, right?
Hmm.
Now the kid is 5 or 7, and maybe that's already gone. Those cues, those hunger cues, because they go to school and they have to eat at this time. And so, there's something, to talk about with your children. It's like, okay, well, this is all the food that we're going to have, and I remember working with some of the young parents and their young children, and they're like, well, they didn't want to eat any of this food, so I'm going to go get them this because they just have to be starving, and I was like, oh, your starving child will eat the food, they will eat what is there. So you don't need to make lots of concessions and all these other things. Like, they'll eat when they're hungry. So don't, there's this gentle parenting idea, like, oh, we don't want to cause this trauma. But at the same time, I see a lot of parents, running around making lots of accommodations and that's not the message we want to send either. So it's definitely a balance, I think, of knowing your child and kind of anticipating, and then, being positive, encouraging about it. But the Clean Plate Club is kind of a little bit gotta go, I think.
So Monica Esquivel is a PhD, a registered dietitian at the University of Hawaii, Manoa. Dr. Esquivel, it's always a pleasure to talk to you. So we want you to share with our listening and our viewing audience in this podcast series what you would like the takeaway to be from this time we spent together, and what you would like our audience to remember, and what are those pearls, those words of wisdom that you can leave our parents with, so that they can talk about the last pea on the plate or the last carrot on the plate.
Well, I start from the end. Parents, I just remind you, you are role models, and you are role models for these children. And so what you're asking of them, we show them as well. I think some other kinds of things, thinking about these families, making food, bringing food back to the center, and family, trying to gather your family together and enjoy one another around eating whatever it is that you have that you can serve your family. I think being together as a family, eating without all the distractions of the outside world, is a nice, important gathering place to make food and meal times a positive thing. And I think that's a really great foundation to kind of grow from for there. I guess that would be my pearls for now.
We appreciate that. Dr. Esquivel, thank you again for joining us. And I'm Kermit Payne, your host for the One Joshua Group production of LifeBeat, a podcast series. And remember, be kind to yourself and be kind to others. Peace.
We would love to hear from you. Send your listener letters, questions, and topic requests to media@theonejg.com. LifeBeat, the podcast, is sponsored by One Joshua Group, your strategic source for engagement to improve life through better health, education, and information. To learn more, visit us at theonejg.com or follow our work on social media using hashtag OneJGCollabs. One Joshua Group, advancing access to healthcare and education by joining what you know with what we've learned.